Hi, today we'll be performing a transfer with my patient here with a post-op hip surgery, transferring from the supine to the sitting and the sitting to the wheelchair back, and transfer to the bed using a transfer board. Today I have my gait belt, my transfer board, walker, and wheelchair. First off, introduce myself. Hi, my name is Risa, your occupational therapy for today. I'll be sitting you up right now. Is that okay?
Yes.
Alright, first off, we know that his left hip had the surgery. We're going to mainly use the right side to help push off the bed. First off, we're going to lift this right leg up. Is that okay? Alright. And then your left leg. And now you'll be using your arms to push off, and the heel of your left foot to push off. Alright? Yep. And you're going to push off and turn, keeping this right hip straight. Make sure you don't go past 90 degrees with your hip flexion. Alright, so he's at a seated position, comfortable. And now I'm going to put my gait belt on to make sure it's safe. He's safe. Alright, so I want to make sure the tag is out on the gait belt and the teeth is biting down on that belt so it can stay tightened. I'm going to loop it back, loop it through. There we go, so that gait belt's pretty tight on there, making sure the patient's safe. Now I'm going to bring the walker over so we can transfer off to the wheelchair. Alright, I'm going to lock the brakes, making sure it's stable. Make sure he doesn't flex more than 90 degrees. So I'm going to have you scoot forward. Yep, push off, scoot forward. Holding the gait belt while he does it. I'm going to have him grab the wheelchair, and on 3, he's going to jump off pushing with his left leg and pushing off with his arms. So kind of like we're hopping. Alright? So we're going to be hopping. On 3, 1, 2, 3. Alright? See how I had the bent knees, keeping my back straight, and performing that? And first off, we're going to move the wheelchair forward, keeping this right operated leg pushing off that wheelchair, coming forward and going, coming forward and going. That right leg goes first, the bad hip, and the left leg follows. Making sure the wheelchair is out in front of you. Then we're going to turn 180. 180, 180, okay? And then we're going to bring that left leg back along with that right leg. So bring yourself back, wheelchair back, bring yourself back, wheelchair back. Alright, grab the handle, and other handle, scoot back. There you go. Alright, on 3, we're going to move back a little further. On 3, 1, 2, 3. Okay. Alright. Now he's safely in the wheelchair, or on the seat. We're going to put the legs on. Alright. Let's slip on. Alright, there you go. I know the brakes are on. Making sure those brakes are on. Before he got down, they were on. Forgot to mention that. Now we have the legs on. We want to make sure he's still leaning back, so that way he doesn't put any pressure or weight on that hip. So now, if he's in the wheelchair, we're going to have him unlock the brakes, and we're going to roll to the bed, pushing my assistance. Alright. Now that we're at the bed, we're going to get as close as possible so that he can safely transfer onto the bed. Alright, so we got to make sure the board is level with his seating position. So I'm going to have him push up with his arms, pushing up his buttocks, and sliding that board under so he can sit down, and making sure he can just slide off. First of all, we're going to lock the brakes. Alright, and then we're going to take the right side handle off so he can get easier access to it. We're going to lift this piece off. Okay, good. Alright, now it's pretty easy to transfer over. I'm going to have him push off on the right side. Hold on. Alright, so I'll be here helping him out. So I'm going to try to get square to his body as much as possible and holding this gate belt as he transfers over. Alright, we're ready. On 3, we're going to scoot over to your right side, laying on the bed. Alright, ready? 1, 2, 3. Moving. There you go. Another hit. There we go. Alright. So I helped support his right side, making sure that he doesn't put too much weight on it. Since this bed is lower, it was a little difficult to transfer over, but we managed with the pillow here. Now that he's on the seating position in bed, I'm going to have him reposition yourself. Scoot yourself back using your arms, keeping that less than 90 degrees or greater than 90 degrees angle. I'm going to have you swing this leg over using your arms, pushing yourself up. Go. Alright. There you are. Alright, he's back in the supine position, using my gait belt and proper body mechanics, just bending at the knees, using the legs, trying to keep that back straight. Alright, so we safely made it. Supine position, post-op hip surgery on the right side, from supine to sitting up to wheelchair using the walker, and wheelchair back, and transferring over using the sliding board. Using the sliding board to transfer over to the bed and back in the supine position. Alright, thank you very much.